You fans who are listening now, we have a Man U Supporters Union, here in Ghana. He's one of the key architects. So, you see, shout out to all the Man U fans. This season, Zexy. So today we're going to talk about Zexy. Democrat is here. Can remember that, my fans.
I know, right?
Yeah. Right. So, Kwame, today we've got a very important aspect of our conversation to share, and I think we got one of our ardent listeners sending in a message. So,
yes.
Why did you do us the honors?
So, today we wanted to field a lot of questions.
Yes,
but it looks like since we have an issue to deal with, we'll still take some of your questions. If you're listening in, for the past 3 weeks, we've been talking about body reconstruction, basically.
Yep.
If you have questions that are pending, you can send us a WhatsApp on 055-1111-997. But one of our good friends says, I'm 35 years and a mother to 3 adorable children. I'm an ardent listener, and I heard the drive doctor and his friend, the plastic surgeon, talking about body contouring. Yeah? I have a unique problem. While most women are talking about adding to their breast size, I am seriously in need of reduction. I'm a small-sized woman, a size 10, but my bra size is now 36G.
Oh, G.
Which one is it?
Just say something.
Okay.
Kwame, Philip knows all these bra sizes.
So
and
the
all
G,
that.
the G
He
is for what?
He can.
The G, what does it stand for?
You are my G for life. Okay,
my G.
It's kind of a measurement of the cup size.
So G for Gui.
Well, you said that, but basically you measure under the bust, and then you would measure on the summit of the breast, and then the difference.
All this long talk. You see, Philip can tell us how to assess the breast size.
The funny thing is that a lot of women actually don't have a proper appreciation of what the bra size is, and we get that a lot. They come into clinic and they struggle, but and you find that people are wearing improperly sized brasiers, and it's causing them problems. But if this woman knows that she's the 36G, well, that is quite big.
Is there a course you study to learn how to measure?
No. I mean,
all right, it's okay.
I think Philip knows.
I wanted to do it's okay. I am a small-sized woman, a size 10, but my bra size is now 36G. I have a myriad of physical and psychological problems. My back hurts, my neck hurts. Guys objectify me, treat me like I'm just a pair of breasts. I sleep poorly, and at such a young age, I'm just fed up. My mom has a relatively flat chest, but both grannies were busty. Can Dr. Ankrah help me?
Right. So, Nii, I think today we are going to briefly look at. Last week we said we'd look at breast augmentation.
Yeah.
But then going through our mail, we found this person, ardent listener, who sent us this message about needing breast reduction.
Yeah.
We don't often hear about that.
Actually, it's actually a slightly more common problem in this side of the world, because the women tend to have bigger breasts than those who have smaller breasts. So you find out that in African women, we get a lot more people coming in for a reduction rather than an augmentation.
Right. So at what point does that become necessary? At what point does it become, or do they come to see you for breast reduction? And at what point would you also, as health care professional, as a surgeon, think that, okay, we need to do something about this?
Okay, so the breast grows throughout the woman's age. It changes. Now, there are some instances where as soon as the breast starts developing, they get really large. So we have 1 or 2 of those instances where these young ladies come in with this problem. There are some women, after they have a child, then their breasts get large.
Okay.
But realistically, it's hard to say that, okay, when you reach cup size E or F, then you need a reduction.
Right.
It will depend on the lady and the kind of symptoms that she presents. Because if somebody has a relatively small frame, and even what you would say a double D or an E, it could be something that causes her symptoms.
Right. And I recall our friend sharing with us that she's got both physical problems and then she's got psychological problems. Can you walk us through some of the physical challenges they have?
So a lot of times they come in complaining about neck pain and back pain.
Neck pain
largely,
and back
yes,
pain.
largely because of the weight of the breast, and sometimes just tugging on the braziers. So they tend to have a lot of grooving over their shoulders from
Right.
the bra straps. Actually, I had a woman who came to see me a year ago. She had been to physiotherapists, to the spine clinic, all because of upper back pain.
Right.
And somebody pointed out that I think that maybe your breasts are too big. And I mean, because of her dressing, her brassiere, and you see her, you don't really think so, but when she took it off, it was quite large. You know?
Right.
And reducing her breasts has solved a problem that she had been carrying for the last 18 years.
Wow.
So apart from the neck pain and the back pain, and of course the psychological problems of objectifying, sometimes they have irritation under their under the breast.
Under the breast, yes.
The sweat
fold.
and yes. So the sweat and then the sweat collects in there and irritates the skin.
Right.
And they tend to have.
There's
a lot
also
of
shedding
problems.
of the skin. I mean, we all shed skin periodically,
Yes,
you know, so
but
that's all
it
trapped.
gets a
underneath.
little bit worse under, and it can be a problem. They itch a lot.
She also talks about sleep problems.
Actually,
an
I
issue?
saw the message and I was it's something I never really thought about. I know that they have difficult thoughts because it's hard to run with this thing shaking around like
Right.
that. But I saw that and I'd never thought of it. She said that she has difficulty even when she turns. She finds that her breasts are weighing down in one direction. I saw somebody a few days ago, and I can now, listening to that, I can actually picture it because her breasts were quite big, you know.
Right. So, should we think about disease if you've got unusually large breasts, or it's just genetics?
There could be a combination of both. And so we always do some investigations before we proceed to do anything about it. Because like I said, there are some people who, as soon as they hit puberty, their breasts just start growing really big. We found out it's like their breast tissue is just too sensitive to the hormones.
Right.
But then there are other cases where it could be, say for example, a certain type of tumor in the brain which pushes out extra hormones, so it causes the breast to get large. Sometimes just genetic. I've seen a family where all the women just have very large breasts.
Right.
But we always investigate to be sure that there's nothing suspicious. And even after surgery, we will always send the sample to make sure that there's nothing suspicious inside.
Right. Can she be helped? And how does that help look like?
She can be helped. Obviously, you would need a consultation, an assessment. Like I said, some labs have to be done. But once we have assessed and we are happy to go ahead, and based on what the patient wants, we will do a breast reduction surgery.
A breast reduction surgery.
Yes. There's different ways of doing it. So it goes outside the scope of this, and it will depend on the patient and what they want and how large the breasts are, what they want to reduce to.
Right.
But everything will be tailored to meet the patient's expectations.
Right.
Doesn't that the reduction surgery, does it have any effect on, let's say, breastfeeding or the functions of the breast?
Yes. Okay. So that's very interesting question.
They are now back.
But it has functions.
Anytime you
Yes,
have
for
that look, what other functions? If you ask nice question, breastfeeding, then you go and add functions of the breast. But okay, let's stick to the the breastfeeding.
So you see, the truth of the matter is that in some cases, what we do, so let's think about the breast. One thing that makes the breast look like a breast is the presence of the nipple, and the dark area.
The dark area.
So
around
that has to be maintained. And part of the surgery is trying to reduce the volume. So definitely we'll take away some breast tissue. Truth of the matter is that in the general population, 1/3 of women can breastfeed normally. A third of women can breastfeed, but it's not enough for the child, and they will have to supplement.
Okay.
And there's a third of women who just cannot produce enough.
Okay.
We can never tell who is who, especially if the woman comes before she's had children. And even sometimes after having children, things can change.
Right.
There is a theoretical chance of reducing the amount of breast milk you produce. But certain techniques are done which can still maintain some breastfeeding.
Right.
There are some of the techniques where it's almost impossible that you would breastfeed, but largely whatever is done, we try and maintain that connection, and we try and maintain sensation to the breast. It's also a very important thing.
The other functions.
The other functions.
Now you know.
Kwame, now
Now you know. Okay, if you're listening and you have questions as well, you can send us a WhatsApp message on 055 1111997, or you can call us on 0302216541. It doesn't necessarily have to be about today's conversation, because we've had
the body contouring,
and
the BBL,
the BBLs and whatnot.
yes, and all that, the facial things. So we've done a lot about cosmetics. But then before we get the calls coming in, Dr. Ankrah, can we talk about the augmentation? Let's talk about those who want it.
Yeah.
I'm too flat-chested. The guys are not looking my direction. I need to have a bit more cleavage. What do you do?
Well, one of the books always starts by saying the breast is a sign of femininity.
Right, it is.
And so, yeah, you do get people also on the other side who have some form of, let's say, psychological difficulties just because their breasts are too small.
Right.
So that too, there are options. Probably the most popular one are the implants. It's a very quick surgery. It's quite easy to control how you would fit in an implant. And they get very good results. People are always worried about, they see all sorts of things on TV, mostly in movies, about explosion and rupture and all that stuff.
Rupture, the implant.
The very, very early implants, way back in the 60s, they had those problems.
Right.
But the newer ones are made in exceptional ways. So, yeah, it's even when you have a rupture, and sometimes this happens after 15, 20 years, they don't leak.
Okay.
In fact, it's been shown and it's been proven that the amount of silicone that would be in breast milk in somebody who has a breast implant is far less than the amount of silicone that you can record in
a non-implanted
formula.
Oh, okay, yeah, in formula feed.
That is in a silicone feeding bottle.
Wow.
Interesting, yeah?
Wow.
I think we have a caller here.
Okay.
Let's see who's here. Hello? Hello? Oh, we lost the caller. All right, go ahead.
All right.
Yeah, so the other thing you can do is also fat. You can transfer fat from another part of the body to augment the breast. At the same time, you can even use it to lift the breast a little bit. So if the lady has lost a bit of breast volume and feels the breast are drooping a little bit, you could use fat or the implants to help improve. There are also techniques that we can use to just improve without a fat or an implant. Okay. But fat is an option. It's a little bit more tricky to work with than the implants, but it can be done.
There've been a lot of concerns when we started advertising the topic. People reached out to me and they were concerned about the feel post augmentation. That if I have silicone implants in there, how would my breast feel like?
Oh, they feel normal. I mean, I have never used. I don't have.
But you fit them, and then you obviously have to check them.
But are you saying you don't know how they feel?
Is there surgery? Why is he touching?
You mean the feel as in?
What are you trying to say, though?
Not in theater.
When you what?
Not in theater. Outside of theater.
The reason why implants were even developed is because somebody filled a bag of silicone and felt like, oh, this feels
Feels
like a
like
breast.
breast. Okay.
So they actually do feel quite natural when
Okay.
they are in.
Okay.
The
'Cause
other
that's a
aspect
big
of the
concern.
sensation that the patient has is maintained,
It's maintained,
because we
right.
just create a bit of a pocket under the breast, the breast tissue itself, which we put the implants in.
Right.
And the nerves are also maintained, the ones that serve the nipple and areola and just sensation to the breast.
Intact.
We got a message here from Kwesi in Dakuman. He says, hi, Kwame. Hi, docs. Very insightful discussion. Thank you very much. My daughter is just a little over 14 years old,
Okay.
but have exceptionally large breasts with the attendant challenges and discomfort. Could she be helped even at this age?
Yes. I do have to say yes. And
Yeah.
it will be good to assess this because, like I said, there are some people who, just when they start developing their breast, they grow really large.
Yeah.
Unfortunately, there's radio, so I could have shown pictures, but sometimes it can be very alarming. And I've had a few who stopped school just because of that.
Oh, wow.
And so once the breasts are reduced, they are able to go back to school, because it's really hard going to school. You know, children, they will not keep their mouth shut, so
Yeah.
they tease them a lot.
Yeah.
Yeah. Wow.
Does weight gain make a difference? Like, because I'm thinking this is 14 years is the pubertal growth spurt
Yeah.
period, but I also realize that some also put on weight in their 20s and all of that.
Yeah.
If you put on weight generally, does that have a significant impact
Yes,
on
it
the
does.
breast size?
The breast is also filled with fat, so as you put on weight, the breasts will also get larger.
So with weight reduction, say going to the gym, exercising and all of that, will that also help to reduce the size of the breast?
It can, but again, with some of these people, like the first lady that we spoke about, it's even hard to get into the gym because
Right,
it's
yeah.
hard to be active with the amount of weight. So we've removed really large amounts. Sometimes you get somebody 3 kilos, 4 kilos. We've had a situation where we removed about 6 kilos. So you can imagine the amount of
Wow.
That's serious.
That's
I mean,
that's quite tough. Right. So it's the procedure. I'm sure because the surgical procedure is not without its risk, surgical procedures, but are there excessive risks, if I put it that way, from going for either a breast augmentation or say a breast reduction surgery?
Again, you have to make sure the patient is fit enough for the surgery. A reduction could take maybe something between 2-4 hours. And an augmentation usually takes less time, especially when you're using implants. It's just about under 2 hours. But you have to make sure the person is fit. Now, typically, I mean, we'll go through all the complications with the patients. But breast reduction, breast augmentation, typically they spend like a day or two in the hospital.
Oh, okay. And then they go home.
Yeah.
All right.
I see. Judas Iscariot says, please tell Dr. Osafo, Lexis, the other functions are very needful to us, so he should allow.
Needful to who people? Which are those interest
Message
groups?
delivered. In fact, Mohammed even adds to it. Please, the issue after the surgery of the breast, we the men want to know if we touch it, our women will feel the sensational feeling.
Yeah, it's very important because sometimes this tends to be a reason why the women don't come in. And sometimes you have a situation where the men are even afraid to touch their wives after the surgery because, oh, you've got a scar on the breast, am I going to hurt you?
Yeah.
But typically sensation remains the same.
Okay.
Very, very rare instances where you may have some area that might not be, but typically with what we do, we try and maintain sensation to the nipple areola complex, and the women are fine.
Okay, this one says, good afternoon, Lexis. Can I get help with ear protruding surgery? Is it possible, and what are the pros and cons, and is it safe?
Yeah, so that is also another thing, what we call prominent ear. And there are procedures that can be done. that reduce it from sticking out
Okay.
wider.
Okay. Oh wow.
Is he asking the question because of Trump?
No, I'm sure he's asking for himself.
Okay.
Certainly not for.
No,
Okay. Well, the good thing is that all these procedures
That's
can be
also
done.
another day surgery.
Yeah.
Typically, you go
Okay.
home the same day.
The same day.
Okay. Okay.
Right.
Good thing is all these surgeries can be done at Medical Hospital.
Absolutely, so Kwame, we've rolled out our plastic and reconstructive surgery unit, just freshly been opened at our new location, East Legon Hills, not so far from School Junction in Ashale-Butwe, East Legon Hills. So we are offering a number of different plastic and reconstructive procedures. Very qualified staff on hand to help you go through the procedure. So as part of our efforts to provide a multidisciplinary service, we keep adding on to the range of services. And Kwame, you know that for our East Legon branch, we are offering a number of different specialist services, mental health, women and reproductive health issues, and then also plastic and reconstructive surgery. So just come and have a conversation with the team, and then we'd see what can be done.
Okay.
But before we round up, let's just one more question, quick one, Nii. How about I'm 55, my breasts are sagging, drooping, and I think I don't like the way I look. Can that be helped?
Yes, that can be done, and we also do that. And sometimes not even 55; they may come at 45. Sometimes even earlier. Yes, so that one.
So that's
to be
not
a
an
procedure.
augmentation, or
No,
is it?
that's a lift.
That's a lift.
Yes.
Okay. All right. All right. Good.
The technical term is a mastopexy, but we call it a breast lift.
A breast lift. Okay.
Sometimes we do it alongside adding an implant.
Right.
And that gives us a slightly better. But everything, like I said, with plastic surgery is usually tailored to the patient. So
Right.
what the patient wants, and then what can be achieved. We work together to get the best result.
Okay.
Right.
Good stuff.
So Kwame, we've got some great videos on our social media platform, especially coming from last week on body contouring. All the information is out there. So those who are listening can go onto our social media handles. Medicals Hospital is our Facebook page. At Medicals GH is our X, and then Instagram handles.
Is there a number to call?
Yes, there is a number to call: 0501 477 340. Our WhatsApp number is also 0501 477 340, and somebody would speak with you.
Dr. Yaw Osafo, CEO of Medical Hospital, and our plastic surgeon, Dr. Nii Ayi Ankrah.